Few things spark panic like extra hair in the shower drain. But when does normal shedding cross into true hair loss? What is normal and what can you actually do about it? In this episode, we unpack the most common types of hair loss, why they happen, and the science-based treatments that really work. Join us today. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. Hello, podcast listeners. Today, we're going to take a little overview on hair loss. In my practice, I treat a lot of hair loss. My practice now is 100% cosmetic, although I do see some medical hair loss. But as I was taking care of my cosmetic patients, I realized, because I had photos from years, like some of my patients I've been taking care of for more than 15 years, and we take photos as we do cosmetic treatments. And looking back at photos, I can say to the patient, I think you're thinning. It's a difficult thing to bring up, but I can tell you there's been some very moving moments that just really made me gung-ho about hair loss. One of them was a woman, maybe late 20s, early 30s, who'd undergone really significant chemotherapy, powerful chemotherapy for a significant breast cancer, not an early stage breast cancer. And they really wanted the best survival for this young lady. And then I even think she was on an estrogen blocking drug after that. But her hair fell out during the chemotherapy. We're used to that. It didn't grow back. And then because she was on the hormone-blocking medicine, what little grew back kind of in a pattern of male pattern thinning or baldness. And here it was a bright, beautiful young woman who could not grow hair. And it was just, to me, I thought it was devastating. And it's not just a cosmetic issue. Hair defines who we are, and it gives us self-confidence. And women just really define themselves by their hair. I probably should have done a better hairdo today for the hair podcast. I didn't even think about it. I did bring my roller. I just didn't use it. But it means a lot to people. So that's one case. And I began to realize that more women than you know, and men for that matter, after chemotherapy don't grow the hair back. So that was kind of motivating for me. Do I have a lot to help them? Not always, but I will do anything in my power to help them grow their hair. And then as you get older, everybody keeps doing their skin treatments to keep themselves beautiful. And they do the relaxer and filler, and there's just beautiful women. But if you're thinning, that you've lost a part of you. And I wanted women to know, and men, I don't want to leave men out, but my practice is mostly cosmetic women, that you can grow hair. We don't have to lose our hair as we age. There's things that you can do about it. Another woman that motivated me, and this is a difficult conversation. I was looking through her photos and I realized she was thinning up front. And so I looked back at her photos, and sure enough, her hair was sliding backwards and she had a medical condition. But I called her after hours, and I was looking at her photos, and I said, she was actually driving home from work. And I said, well, I just noticed a change in your photos. Do you feel like your hair's thinning? And she said, yeah, I think it is. I said, well, what I've noticed is your hairline's creeping backwards. I would think, if you would like, I would like you to make an appointment and let's discuss it. And she did have a scarring type of hair loss. We fixed the process from progressing, but because it's scarring, we couldn't correct what had been lost, but we controlled what was going on. We got her in for treatment, got her treatment going, and then she could have a hair transplant, and she's back to her beautiful self and confident self. So hair it's not just nothing. at all. And I think the message today is to just kind of tell you what goes on in a hair consultation, what we do. We'll only focus on the major hair loss types. We can maybe later do a deep dive on some of the other and let you know what you can do about it. We'll get into some of the treatments too, because that's always fun. So there are probably a lot of people at home that go, that's just old age. There's nothing I can do. I don't think that's true anymore in 2025. So I have today with us Robyn Allen, a nurse who's worked with me for many, many years, and she has helped me take care of hair loss patients as we see them together. And she does many of the treatments. She's done some of the laser as well as our excellent laser staff down here. But she's also been doing the PRP, platelet-rich plasma injections. But let's just start the basics, Robyn, and tell our audience, what happens when they come in for a hair consultation? What is it like, and what do we do?
When you come in, we will give you, it's actually a very detailed questionnaire with questions on hair loss, how long, have you been doing anything? And that kind of gives us an idea that we kind of can look at history-wise.
Yeah, it goes into everything, doesn't it?
It
Nutrition,
really does.
stress. I mean, it gets kind of personal questions. I ask, is there anything wrong with your diet? And are you having any hormonal changes? And then we get into stress and some other events that can lead to hair loss, right?
Yeah, stress, surgeries.
Stress, surgeries, illness. A lot of times all those, there's nothing going on, which is fine. We just want to get a baseline. And Robyn, what do I do with that? Throw it in the trash?
Nope. We actually look at it.
Look at it in detail.
Go over it. And when I'll take that when I'm bringing you back to the room, and then we do this whole set of pictures down the middle, the front, the back, the sides, so we can compare them at each visit. So we're able to see, okay, is the hair doing what we want? Is it increasing in thickness? Is it just more everywhere? Or are there certain areas that we still need to work on?
I agree. And sometimes, depending on the type of loss, we'll even do a tape measure from the brow to the hairline, so you can know if it's progressing backwards. Some people, ponytail thickness is a big deal for them, and if we think we can measure it, I will. These measurements and these photos mean something to Robyn and me, but they will mean something to you when you come back to follow up. So it's kind of invasive, us doing these photos and digging through your scalp. And I really appreciate Robyn taking the time, and sometimes we take them again if I'm not happy with them or something wasn't right, because I really like to dial down. So I review all that. I review the photos and what Robyn's telling me, and maybe I have an idea before I go in the room. But then I generally hear the whole story again, which is fine. This is your opportunity to tell me what you're noticing. And we just kind of talk, and I might direct things with some questions. And then I take a look, even if I think I know exactly what it is. I take a look. And I ask you about symptoms in your scalp, right? Like itch, burn, pain. I take a deep dive with my 10X loops, looking at the root, looking at the scalp. And then I'll often ask Robyn, almost every case, I'll look at it with what's called a dermscope. And that's how we look at moles and skin lesions and try to diagnose things. But this whole dermoscopy of the base of the hair is called trichoscopy. I don't have any fancy device to do it. It's just me. There are experts in this field. I'm not that expert, but I do take a look, and I look for clues. I want to make sure your scalp is healthy and your hair is at least growing, and just get a sense for what's going on. I can look for patterns. I can look for scalp conditions. I can look at the density of the hair growing out. And you know what else I do? Now we're really getting invasive. What do I do, Robyn, with my hair pull test?
You literally will go through, and she pulls kind of hard. And pull and tug to see how many loose hairs are coming out.
Correct.
And whether they break or it's at the root.
That's called the hair pull test. And you grab 10 or 15 hairs at the root. It's kind of like running your fingers through your hair, but with a firm grip. And I just want to see what comes with me. It's ideal if you actually come to see me with kind of dirty hair, one that has not, or I should say, not everybody's hair gets dirty.
Yeah.
Mine does. But one hair that's not been washed in a couple of days. The reason why is when you wash your hair, the hair is going to come out. The hair that is meant to come out is going to come out. I hear from some of my hair loss patients, oh, I quit washing my hair but once a week because I don't want to lose that hair. Well, that hair is destined to come out. It's coming out at the root. And when you get the hair wet and you run soap through it, and particularly conditioner, all it does is create a slick exodus for that root. It's kind of like if you were trying to do a pipe fitting or something, you'd use silicone if it was a tight fit, because you're just trying to slick it so it comes together or it comes off, like you use oil to get tape, sticky tape off. So shampooing your hair does not make you lose your hair. It just simply facilitates the hair coming out. So if you shampooed that morning, my hair pull test might be negative. I'll take that in consideration. And then I talk to you about the hair pull test when I'm in there. I'm like, I think this is mostly normal. That doesn't mean the visit is over. That doesn't mean you're going to leave without any help for your hair. It just simply means I think the hair pull test is normal, but we're still going to address everything else. If I get a positive hair pull test, it's really just handfuls. Then I get worried about a shedding disorder, which is a good question. We get this a lot, and sometimes it confuses patients. Maybe Robyn can explain. And I'll say, do you think you're shedding or thinning? Or both. Both is okay.
A lot of times they're like, it's both. But they're like, no, I'm shedding. I see these hairs all over the sink.
Yeah, so Robyn, what is the difference between shedding and thinning?
Shedding is more all over. Thinning can be more of like a pattern, which you would focus it more like in this area.
I don't think thinning can be all over too.
Yeah.
Shedding is when you really just think you're losing a lot of hair, there's a lot in the drain and a lot on the floor. Thinning, I think, and I hear people say this, well, I don't think I'm shedding more, but I sure am getting thin. And that the thinning occurs over a longer period of time. And so maybe they're not noticing the shed, but they definitely notice more thin than I was 4 or 5 years ago. So it's kind of gradual. And then, of course, both can happen because if you're shedding heavily, then you may also feel like you're thinning. So these questions I ask you, they do mean something in my interpretation of what's going on. Another test that we might do if I'm looking around and I'm not real sure what's going on, I do compare, after looking at your scalp and the hair coming out of the scalp and the hair pull test, I will divide your hair, part your hair with a fine-tooth comb down the middle, midline part. And then I'll do it in the front and I'll do it in the back, and I'll compare the part sizes. How wide is that part? And if there is a differential, to me, that means you're thinning more up front than in the back. And that is a patterned hair loss. Pattern thinning, which can represent androgenetic alopecia or female pattern thinning in males. It's male pattern thinning, but they're both androgenetic alopecia. And let's talk about another test that I might do before we talk into kind of diagnostics and where we go from there. I might choose to do a scalp biopsy. If I just can't decide right off the bat that I'm going to know what this is, I might decide to do a biopsy. Robyn, can you tell our audience what we do with a scalp biopsy? And to us, it's very routine, but we do want to go through the trouble to tell you all about it. And before we even do it, we may decide to skip it, right? But
and sometimes we do.
How do you explain the scalp biopsy?
I explain it as we mark the area, we do inject some numbing, but we take almost like a little core sample. I kind of compare it to like a cookie cutter. It seems to be what most patients kind of understand. So we get this little kind of plug or core. So that way when we send it to the lab, they can look at it and look at the root and do all the dermatopathology that they do with the slides. And sometimes not, but there's either like a little piece of foam or sometimes a stitch that's put in. And we have you come back a couple weeks later to have that out, and then we discuss the results because we're hoping maybe it'll give us more of a clue as to the type of hair loss that you've got going on.
Exactly. It gives us something that I can't see in the exam room. I don't have the tool to look at it, but the pathologist can look at it under the microscope and tell me, is there inflammation there? What are the hair follicles doing? I think a lot of people think a biopsy is like a blood test, or your glucose test. I've got a glucose of 89. That's not true for biopsy all the time. Sometimes we just get some clues about what's going on. We kind of have to put it together with everything else that we know. I think that's the basics of kind of how we evaluate hair. People do come in with baggies and baggies of the hair that they've lost, and that might mean something to me, but usually it doesn't. And the reason why is if you wait a long time in between shampooing, you're going to get a whole lot of loss. I mean, just think about it. If you've skipped shampooing for a while, if you've got long hair or thick hair or curly hair, it's going to look like a lot. Now, yes, I've had patients bring in literally a month's supply dated, and I guess I could look at it and see that each one is getting more or less, but it's very difficult. I don't weigh it. It doesn't mean anything. But if you want to keep bringing them in, keep bringing them in if it makes you feel good. It's not that helpful for me. What is most helpful for me is hearing it from you. I'm shedding. I want to help reassure you if this is normal or if it's abnormal. So let's talk about hair just medically for a moment. So alopecia is the medical word for hair loss or thinning. That's it. It means nothing. So I have people come in and say, oh, she has the alopecia. No, alopecia is just hair loss. And when, I guess her name's Jada Brown Smith. Jada Pinkett Smith. Thank you. You can see how good I am with pop culture. It's okay. I spend all my time studying hair treatments, and lots of cosmetic. I'm not studying who won the Emmys. However, even this caveman here who does not look at the internet was well aware of Will Smith going up on the stage and punching
Chris Rock.
Oh, yeah. Now, he's funny. I do know him. Chris Rock is funny. I got him. I'm pretty good with comedians. Because of some comment about, anyway, she had alopecia areata. Yes, she had alopecia, but everyone has alopecia if we've diagnosed you with hair thinning disorder. So it's just alopecia. Alopecia areata is an inflammatory immune-mediated disease. We're not going to touch on that today. But I thought we'd talk about the two main things that we see. One is just a slow thinning in a pattern. We've already said the word, androgenetic alopecia, andro, meaning androgens, a hormone, male kind of driven hormone, but it balances. We all have androgens, causes things like hair growth, hair loss on the top of your head, acne if you have too much. So androgen-mediated disorders. Androgenetic, there's typically a genetic component. Alopecia, which just means hair thinning or loss. We used to call it male pattern baldness, and I know there's some men out there who go, yeah, it's male pattern baldness, all right. It's all gone. Women do not go bald in the absence of a hormone disorder. I'm not talking normal hormones. I'm talking something that's way out of whack. So women, you're not going to go bald with this pattern thinning. So we call it female pattern thinning and usually male pattern thinning, but it truly is male pattern baldness. And those are the thinning disorders. The major shedding disorder we see is called telogen effluvium. Telogen effluvium. Telogen is the resting phase of the hair, and so that's the stuff that you get out of the shower after you shampoo and you're cleaning the drain. Those are telogen hairs unless you're having breakage. That's a whoopsie if you're having breakage. And telogen can come on from stress, diet changes. We've got a lot of people on GLP-1 inhibitors right now, and lots of shedding from that. But other things, after childbirth, after a major illness, after hospitalization or surgery, things like that. And it doesn't show up immediately. So I'll tell you how I describe it. And Robyn's heard this, which I think works. I describe it as if you go on vacation for 3 weeks, I've never done that. But if you do, and I will in my future, and I leave Robyn in charge of my home, and I've got a nice house plant. I've got like a beautiful ficus tree. I don't, but if I did. And I said, Robyn, I need you to water it. But she forgot. I mean, she's got a lot to do. She's coming to work. She's got my dogs to take care of. And I don't think anything of it. I get home and I start watering it. And it looks fine. It looks fine for a while. I mean, really a good long while. And then all of a sudden, all the leaves fall off. And so I go back to Robyn. I'm like, did you water it? Right? And she says, oops, I forgot. That tree is fine. My ficus plant is fine. The roots are fine. The leaves are going to grow back because I'm home now. I'm watering it. I'm taking care of it. I'm spraying it. I'm giving it fertilizer. It's going to grow back. That is what telogen effluvium is. It's like you've had an insult. Your body's like, something's happened. And it kind of goes into a little, not shock like trauma shock, but just a hold back mode. And the more hair goes into resting. The roots are fine. They will grow back. In this disorder, really often not a whole lot I do. We can support hair growth, but if we think it's an ongoing issue, we need to address it. So what are some of the tests that we do if we think we need to investigate a shedding disorder?
Oh, there's the blood tests.
Yeah, we get some labs. Mm-hmm. We will check some blood work. Mm-hmm. We're looking for things like your iron level, your CBC, your blood clot.
Ferritin, vitamin D, magnesium, thyroid.
We'll check a thyroid. Just a basic metabolic panel. Just see where things are. Now, low vitamin D and low magnesium do not cause hair loss, but they might help us with hair growth. So I check them. Okay, they're not the cause of your hair loss, but low iron can be, and we will correct that. If you're thinning, if you're shedding, and you've got a low normal ferritin, so maybe you came in and said, I just had it checked. Doc said it was all normal. I still chase down that level because I'll treat a low ferritin, try to get that up on the high side. So we'll try to address any stressors in your life. Make sure if there's something ongoing, we have a plan to address it. We'll check some lab work, make sure everything's normal, and then maybe we just give you some things to help you grow hair. And a lot of times we reach this point in the consultation where I think I know what it is I'm talking about. I don't think it's that bad for the patient. I just ask them, I'm like, what did you expect from this visit? How can we help you? Are you happy just knowing, I think it's not that bad, it's okay, and you're going to recover? Or is this keeping you up at night and you're really stressed about it? So it's a back and forth. How much is this bothering you? And where can we help? So let's talk about some of the ways we can help. We've talked about the shedding disorder. We've talked about the hormone disorder, and those are what we see. Robyn knows this better than I do because she's the one that puts the prescriptions in the computer. So a common one we use is low-dose oral minoxidil. And Robyn, you educate our patients about it. Can you tell our audience a little bit about low-dose oral minoxidil?
The low-dose oral minoxidil just grows hair. I mean, it works for pretty much everyone. The success rate, just growing hair, it does take time, just like any of the other treatments that we do. Most people, we just make sure what their blood pressure history is, if they are prone to lightheadedness or dizziness, cardiac issues, anything like that, because we educate them that it was originally created in higher doses as a blood pressure pill. So sometimes you can get a little lightheadedness, dizziness, sometimes like lower leg swelling. I tell people, like, if you notice it beyond like a normal being on your feet all day, something that kind of draws your attention to it.
Yeah, good advice.
Yeah.
A lot of low-dose oral minoxidil prescriptions come out of here because we're treating a very healthy population. If you've got fragile heart disease, chances are you're not coming here to talk about hair loss anyway. But I do treat a lot of older women. I worry about them getting dizzy when they get up from seated position and falling. And so I don't want to create a fall. But most people do great on this. There is one side effect, aside from the medical side effect, that women really worry about. And what is that, Robyn?
Hair growth.
Hair growth.
Mainly, it can happen everywhere, but the face is where a lot of women get concerned.
They feel like it's going to grow a little bit more. So for that reason, we do use a low dose. So I used to start people on a quarter tablet, but we've gained so much confidence with it in a healthy person. I'll start you out on a half tablet if you're a woman, and maybe a full tablet if you're a healthy man. If you're a man with any blood pressure problems or maybe a little cardiac issue, we'll still start out a half tablet a day. If we increase that to one tablet in women, you'll grow more hair. The problem becomes the risk of hair growth where you don't really want it, maybe on your sideburns, upper lip,
Common complaint.
upper thigh. I mean, you can shave it, but it's hair. That risk is close to 20%. It's not a guarantee. And we do have women on a full tablet of minoxidil. So a half or a full tablet of minoxidil. The other medicines we use may be more specific for the androgen-mediated hair loss, the androgenetic female pattern or male pattern. And one class is 5-alpha reductase inhibitor medicines that can have sexual side effects and mood side effects. We talk about that. If there's any discomfort in those side effects, we might recommend a topical solution. Topical meaning you put it on your scalp. And then in women, we can also use spironolactone. So the two 5-alpha reductase inhibitors are finasteride and dutasteride. A recent meta-analysis showed that dutasteride, 0.5 milligrams, is the best treatment for patterned thinning androgenetic alopecia in patients with that condition. So we know that that's the best treatment, but sometimes we do other things to avoid any potential side effects that we're worried about. In a treatment plan, you go home with a handout, completely the front and the back of what we think it is, what we're going to do, workup lab, or what you're going to ask your primary to look up. Prescription medicines, then we do talk a little bit about nutrition, particularly for women, because women like to grow a long hair. That's a long hair cycle, so you've got to take care of it. We go over supplements. There's a couple of supplements we recommend.
The Viviscal Pro and the Extra Say gummies.
Yeah, they're popular, aren't they?
They're very popular.
Yeah. If you have a fish or shellfish allergy, you can't take Viviscal Pro, but in my mind, it's one of the best things for it. Not because it's the most efficacious. It is very helpful. I take it. I think it's very easy to take, but it is the most well-studied with placebo-controlled trials. The Extra Say hair gummies have a lot of ingredients such as ashwagandha, coumarin,
taurine, NAD,
some pea root extract,
saw palmetto.
Things that are also in another popular hair product called Nutrafol, and they do show up in a lot of hair and nail products. The problem with hair and nail products is they all have biotin in it, including the Viviscal Pro, but it doesn't have that much. Nutrafol and some of the products that my patients are taking that they get online or from the drugstore have some of them have 3,000 times the recommended daily allowance of biotin. And a word on biotin, it doesn't seem to help hair growth at all. It makes your nails strong, but it's just become popular, and I think that's why they put it in there as consumers are looking for biotin. And there was a recent study where something like 70 or 90% of the people surveyed, they came out of a dermatology clinic, not for hair loss, but just a dermatology clinic, didn't realize that biotin affected their lab work. It can affect your thyroid testing and even cardiac enzyme testing. So that's what we recommend in the supplements. And then we move on to some topicals that you can use. These can be difficult for women. choose who I recommend a topical for very carefully, but it's usually easier for men to use a topical. And some of the topicals can be expensive, like topical exosomes. They're very pricey, but I like using them if there's a real problem area that we want to target, like frontal scalp. Like that is a critical area for women when they style their hair, the bitemporal and here. Sometimes it's in the back, in the crown. Love it for men. It's easy for men to use. Exosomes. There's another product called Definage that's got a peptide. And the peptide stimulates a cell that lives in the hair bulge and stimulates renewal there. Not specific for hair growth, just renewal. So again, using these on particular problem areas while we're waiting for the other stuff to grow. You can use it all over your scalp, but we try to give you some targeted areas just for ease of use and comfort. We also have some prescription topicals that we recommend. What's the prescription one we recommend?
We recommend it's a compounded prescription of finasteride, 1% with 7% topical minoxidil.
Yeah, it's pretty nice. A 7% minoxidil.
Solution.
Yeah.
And it's nice. It has a dropper or it's got a sprayer attachment.
It is nice.
A lot of the people just like using that spray attachment.
Well, and it is of a consistency that is doable for most patients, which is important. Unfortunately, with topicals, a lot of people don't use them. That's how we ended up with these oral medications. So I think you can see hair loss treatments don't live in like one box, like, oh, you're getting this. We try to put everything together. So we're going to investigate anything that we need to. We're going to talk about nutrition and supplements. We're going to prescribe medications that you can take orally if that's a fit for you. We're going to consider some topical agents, things you put on your skin, either prescription or cosmeceutical, meaning peptide or exosome. And then there's also an at-home treatment that you can do. I'll confess I do it, and I have a lot of my friends on it, actually, because there was a phase I was running around telling my friends their hair was thinning. Sorry. But they were. I mean, we're all kind of menopausal. The conversation at our supper club has shifted from like, oh, what elementary school are you enrolled in, or what teacher do you have, to now it's unbelievable how much my kid is partying at college, and are you having hot flashes? And then Dr. Liz sitting there going, I think you're thinning. And I do say that because we want to get it early, so I tend to say that. But an easy thing for them to do was for me to give them a coupon code to buy an LED cap called Revian. And Robyn, can you tell our audience about the Revian red cap?
It has 2 wavelengths of light. It's got red and yellow. And it's just this little cap that you just put on 10 minutes a day, app-driven through your phone. And a lot of people find it kind of interesting because it kind of gives you like a percentage of, basically how much you're kind of using it. Like, did you use it, 80%?
Yeah, for the
90%.
OCD out there, this one's for you. The app tells you. I even got a little obsessed with it. We used mine initially kind of as a demo in the clinic. And so we would go days and weeks without being demoed. And then I just finally I was like, I'm taking this home and using it myself. So I had this like track record of months of no use. So I've really been beating my horse to get it back up. But I do have a friend who just loves it. She goes, Liz, I'm at 98%. I had to go out of town and I missed it. It's something. So the magic spot is supposed to be 70%. It doesn't work for everyone. It's expensive. I think it's easy to use. I tend to put it on in the morning, and while I drink my coffee and get the dog's breakfast ready or answer email, it's on. My husband makes fun of me, but it works. And then there's in-office treatments we can do. I mentioned the laser. It's called Keralase, and we've known, not just me, we as an industry have known lasers stimulate hair growth in the scalp, a particular laser, a 1927 or a different wavelength thulium laser. But I never fooled around with it because it was just like, how can you get it in there, in that scalp and whatever? So Lutronic, we have their device called Ultralaser MD. It's a phenomenal 1927 fractional laser, very efficient energy delivery, state-of-the-art, top-notch fractional laser. But they were smart enough to develop a handpiece. I should have brought it on our show. It's hard to lose. It's like a little V, so it can get through the hair. The laser does two things. Number one, the laser itself stimulates hair growth. Number two, when we do a laser, and we use this for a lot of applications, it makes the skin more permeable to things we put on top. And so we can pair this with a proprietary growth factor put on at the time of the treatment, and then you go home with one. And then if you're using the peptide or the exosomes, they get in better. It's a great treatment. It's really remarkable results. On our YouTube channel, we'll try to share some before and afters from the company as well as from us. And same thing with the LED, so you'll kind of know what we're talking about. And then at the beginning of the show, I mentioned PRP, platelet-rich plasma, and Robyn does this. We have to have someone in our office that's good at a blood draw, because you draw your blood and stick it in this very loud centrifuge that brings it down, separates out what's called the platelet-rich plasma that's then drawn up into syringes. So it takes a little while. You're in the office for a little while. And then Robyn injects it in the areas of interest. So Robyn, can you tell us about the injection procedure and how it goes? And Robyn and I do it together also. So it's Robyn or it's Robyn and me. It can be a bit much having two of us inject, but tell us how it goes.
You got both of us on each side going. But once we finally get it ready, because it does take a little while, it takes 15, 16 minutes for it to spin and separate, and then we pull it up into these syringes. But we just kind of focus. Sometimes it's this whole area, or we focus this whole area, but then it's like, okay, we're more thin back here, so we'll save an extra syringe or so for back here. And we just kind of go in just a certain distance apart, kind of in these little lines, but to make it a little more comfortable, because it is uncomfortable having the injections in the scalp. We have little massager, these little, it's like this little frozen kind of metal ice type thing, just as distractions to make it more comfortable. And then afterwards, there's really no restrictions or anything. You can just go about your day.
Yeah. We do our best to make things comfortable for our patients. We do a lot of procedures. It's a big focus of ours. Here's a procedure where I have to confess, nothing makes it that comfortable. It's very doable. People come back for their treatments. No one complains too much about it. If they need a break, they take a break. But it is a bunch of needles. And sometimes cold air, sometimes the cold makes it worse. We can pre-treat with Tylenol or something. But I think it's the one procedure where we don't do, it's not pain-free, but it's somewhat manageable. And those are very nice treatments in the office. Another treatment we have, if you're having scalp issues, and sometimes the scalp issues go hand in hand with the hair loss we've been talking about, is hydrofacial for the scalp. If you're having scalp buildup and you just can't get the scalp clean of cellular debris or buildup or oil, it's a great treatment for that. So that is not a requirement for any of these other treatments, but it's a nice treatment as well. So I think in this podcast, we've kind of gone through what happens in a hair consult and how we diagnose, things that we use for treatment, treatments we might recommend for you. And I think that alone should dispel the myth that there's nothing you can do about hair loss. You can. I think a question that might come up is, gosh, do I need to be seen? And I don't know that answer. A lot of times in passing, if someone asks me or asks me about a family member, or they've just undergone several biopsies and a whole skin check we just don't have time to address, we can certainly recommend the supplements to get started and then make an appointment to be evaluated. There's definitely things that you can do. The Express A is over the counter as well as the Viviscal Pro. And the topicals, the cosmeceuticals, the Definage and the exosomes are good. What we want to do, though, is if you think there's really an issue, to have you come in for an appointment so we can put the whole package together for you. I will say I did have a gentleman within the last couple of years who underwent a series of the Keralaze laser treatments I was telling you about. But unbeknownst to me, he stopped everything else. And that's just not how it works. So he was telling me, well, my Keralaze didn't work. I'm like, well, it's like pouring water into a bucket with a hole in the bottom, right? You got to put everything together. And so that's the idea that we like to say. We got to kind of look at it from every aspect, and that sometimes includes the stress in your life and things that might be painful to talk about, but we put it all together. And maybe we'll end with, I've told you some of the success stories we've had about how I got into this. Well, they weren't necessarily success stories. One was, but just things that interest me and said, I need to treat hair and take it seriously and help people. I have another cosmetic patient that she's just beautiful, active, gorgeous, 62-year-old, really phenomenal. I have a girl crush on her. And again, when she comes in for filler, I'm looking at her photos, and we put on a headband, and she's got her hair behind her so I can look at the face. But then I go in to do the filler, and I see the back of her hair, and it's thin, and it's wispy, and it's just, there's nothing there. And I was like, what is going on? And I hadn't noticed in the previous year she had hair extensions. It wasn't the hair extensions that caused the hair loss. She had hair loss, and she's like, I've got to do something. And so she put hair extensions in, but they were running their time course, and she was having some side effects, so she took them out. Well, I want you to know we started her on the full-fledged program I was telling you about, putting together prescription oral medications, topicals, maybe the red cap, putting it all together, and she has the most richest, luscious head of hair you've ever seen. So you can have success. It is quite doable. I had another patient, we didn't talk about what we kind of call medical hair loss, but the scarring hair loss. We'll hit on that in another podcast. And that's where the hair loss is such that if it goes on without getting treated, the hair is gone. It's replaced by scar tissue. And so the particular type of hair loss is common in afro-curly hair called central centrifugal cicatricial alopecia, CCCA. And that's what this young woman had. We treated that, brought that under control, and but she still had big bald patches from where the hair was lost, and she got hair transplant. So these things are doable. You have to work with the cosmetic team and the medical team. We can put it all together, and you can have success. So that's how we approach hair here. But I think the message is we approach it with an interest in you and making you better and helping you achieve where you want to be in terms of how you look and feel. And it's a value to me and my staff. All of us here treat the hair loss, Dr. McLean, as well as our PAs, yes, Ellie and Alexis. And I think I've infused that passion to them by sharing my stories and these success stories. So if you think you're thinning and you need to be seen, come see any one of us. We'd be happy to help you. And I appreciate you tuning in today. And we'll dial deeper on some of these other topics we didn't touch on at all today. We'll do that at a later time. Thank you.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.